Okay, painless. Large volume hematochesia. Next point, patient is hemodynamically stable. Remember that when we're learning the objectives, what the objectives say, learn how to manage the hemodynamically unstable patient and the hemodynamically stable patient. Remember, this patient has painless large volume hematochesia. Remember that we also said in the beginning that diverticular disease and all that are one of the main causes of large volume hematochesia. Now, are you going to do CT angiography? Are you going to do colonoscopy? Are you going to do tagged red blood cell scan? Or are you going to do conservative management with observation? Please type your answers. Please type your answers. Someone is going for some are going for C. Some are also going for D, conservative management with observation. Some are going for C. So what's the correct answer? Correct answer is B, colonoscopy. Now, don't fret yet. In which condition do we not do colonoscopy? No. In which condition? When I'm talking about diverticulosis, diverticulitis, diverticular bleed, which of these don't do is colonoscopy contraindicated? Diverticulitis. Now, colonoscopy is the test of choice in hemodynamically stable patients with suspected diverticular bleed. Remember that diverticular bleed is totally different from diverticulitis, even though diverticulitis can lead to bleeding. So, is it everybody who has diverticulitis who bleeds? I have a question. Is it everybody who has diverticulitis, acute diverticulitis, who has rectal bleeding? Hello, doctors. Can you answer me? Is it everybody who has acute diverticulitis who has rectal bleeding? Yes or no? No, yes or no? Is it everybody who has diverticular bleeding? No, diverticulitis who has diverticular bleeding? Yes or no? No. Okay. Is it now the next question? Is it everybody who has diverticular bleeding who has diverticulitis? Yes or no? No. So you can have diverticular bleeding without having diverticulitis, because assuming the patient is taking warfarin and the patient is just bleeding, does that mean that the patient has diverticulitis? No. But remember that we said colonoscopy is contraindicated in what? Is it diverticulitis or diverticular bleeding? So now the learning point is this. If you have a patient who has diverticular bleeding with no evidence of diverticulitis, what in the question points the fact that there's no evidence of diverticulitis? Painless, because diverticulitis is usually painful. So this is the learning point. If you have a patient who has no evidence of diverticulitis, number one. Number two, that patient is hemodynamically stable. Number three, that patient is only having diverticular bleed. The investigation of choice is colonoscopy. Please write it down. You have a patient, hemodynamically stable, no evidence of diverticulitis. Patient is doing well, has painless abdominal pain, even though there's rectal bleeding. You can do a colonoscopy.